the board members that are on, could you please just announce that you're here so we have proof that we have a quorum? Lois?
Yes, can you hear me?
Yes, I can.
Okay, I'm here.
Tim?
Yes, I'm here.
Okay, Jennifer Hedrick, she had called me that she was not Naomi, or Dave, we heard you. Naomi?
Yeah, I'm here.
Naomi? Jennifer Keys? And Kira?
I'm here.
Okay, and Jeff Harris is also on the line, he's not part of the committee, so we do have a quorum. Roll call has been taken. At this time, we will have 30 minutes of public comment. I have a timer here. I'd just like to say that this is time for public comment. It's not a question and answer. You can ask me all the questions you want, I'm not allowed to answer any of them, so you may start.
All right, thank you. I'm Bradley Williams from Mayville. Dear committee members, thank you for your public service. This COVID plague has been stayed by the hand of God. Polio paralyzed and killed 500,000 people every year for 20 years. COVID is no plague. Perhaps our health department only needs to report the bare bones headlines to qualify for more CARES Act taxpayer funds. But we deserve, and you deserve as policymakers, more specifics, such as how many cases had symptoms, what is the percent of recovery, if we had a flu shot, will we test positive, how many hospitalizations or one-night stays for observation, how many stays resulted in a negative case, what are the underlying illnesses listed on the death certificates. For example, recently, the health department reported, quote, while 5.7% of those known to have contracted the virus needed to be hospitalized. We need more specifics like what percent of the hospitalizations were overnight stays for observation, percent of negative case after observation. Then the quote, Dodge County has 19 deaths on record. What is the underlying what is the tally of the underlying illnesses? Policymakers need all the information. Please refuse to recommend a COVID ordinance. Kill it right here tonight. Thank you for your consideration.
Hi, my name's Josh. At the beginning of this pandemic, we were given some numbers about how dangerous this was going to be, and everyone was scared, and we all took some preventative measures at that time. However, now in comparing those rates with what we can see it is now, the CDC has recently released some recent numbers concerning their best estimates for the fatality ratio for COVID. In comparison to the flu has a fatality ratio of 0.1%. Here, according to the CDC, if you're 0 to 19, your risk of death is 0.00003, 20 to 49, 0.0002, 50 to 69, 0.005, and if you're over 70 years old, it's 0.054. So according to the CDC, their numbers would indicate, logically, that it has half the risk of death in comparison to the flu. Even at their very worst scenario for if you're over 70, it's 0.09, so it's still under the flu. So it just seems to me what is this all about? I mean, why are we doing all this? This makes no sense. Currently also, total annual deaths in the U.S. for 2018 were 2,839,200 2019, 2,855,000, and 2020, so far, we are at 2,033,000. So we're actually on track to have less overall death for 2020 than 2018 and 2019. So again, just what is all this hype? I mean, are we just being lied to by our media? Why is this happening to us? Why are we shutting everything down? This makes no sense. And then I'll just close with President Trump's latest tweet. Let's see what he has to say about it. This tweet was actually blocked by Twitter. It's just hilarious. Anyway, so he recovers from the flu from COVID, and he writes, he tweets, "Flu season is coming up. Many people every year, sometimes over 100,000, and despite the vaccine, die from the flu. Are we going to close down our country? No, we have learned to live with it, just like we are learning to live with COVID. In most populations, far less lethal." All right, that's all I have to say. Thank you.
Hello, my name's Ross Perry from Town of Hubbard. I understand our Highway Commission board was told to quarantine, but the head of that board said he was too busy, and somehow the quarantine was reduced to 1 day. I'd like to hear an explanation for that. Is that how this ordinance is going to be applied and run? You own enough land, you get your quarantine reduced? And a certain contract tracer who contacted one of the board members after the quarantine was reduced is saying that the labs being utilized by Dodge County have numbers all over the map. There's no standard protocol. There's no standard testing. And that's what we're probably going to be basing a lot of the, I can't think of the word, implication, the putting this ordinance into practice. So it's going to be based on lab tests and numbers in which there's no quality control, there's no standardization, numbers all over the place. Are we gonna put an ordinance in place when we're clearly not equipped to follow through properly on this?
Hi, my name is Brenda Williams, I'm from Mayville. We don't need the ordinance, we don't. I, for one, take care of my own health. I know when I have to go to the doctor, know when I shouldn't go to the doctor. There's no need for this. So we're asking, we're supposed to be our mouthpiece, we're asking you, throw it out, and then don't go any further, so you need to use not need it or want it. So please, be our mouthpiece, throw it out.
Good evening, everyone. My name is Carrie Hessel, and I live in Horicon. And I'm here to respectfully request that we focus on the promotion of health. Okay, there's a divide right now in our country and in our county. One side is afraid, and there's little to no empathy from one side to the other. One side is very much afraid of the virus, and we have some fear on the other side of government control. It is my belief that the role of government is to protect our liberties, not to control our lives.
They don't.
So I believe the proper course of action is persuasion and education. I honestly believe that we can work together to be respectful of each other's boundaries and each other's beliefs. And I don't think there's only one way to address a health issue, okay? Like when I go shopping, I should be able to choose if it's crowded, should I wear a mask just in case I cough or sneeze, or should I keep my distance and be respectful of the people who are scared? Okay, from the bottom of my heart, I am nothing but respectful to those around me. And all I ask is for when you decide on what kind of health ordinance to make, that you take all views into consideration. Because right now, the anger and the fear, it's not healthy. Okay, I work in natural health. I don't work in natural health, but I love natural health. And believe me when I say this, the anger and the fighting, it's just going to make us weaker, and it's going to be harmful to our health. So please, let's not fight about this. Let's work together, be respectful, and promote health. Persuasion, not coercion, I believe is the proper path. Thank you very much, and thank you for your time.
Go for it, Dan.
You're a tough act to follow.
Yeah.
Hi, Dan Sigmund here from Rubicon. Want to address agenda item number 7 on the meeting for tonight. WCA guidance recommendations. 5 reasons why the WCA is not to be trusted. Number 1, if you notice the disclaimer on page 5, paragraph 1. In other words, don't trust my advice. They are not going to be able to be held liable for anything that they suggest. Number 2, anti-freedom, page 4. The work group was guided by 4 principles, and being constitutionally sound was not one of them and was not even considered. Rather, they tried to find ways to skirt around constitutionally secured rights of we the people. Number 3, anti-family, the WCA 2020 conference resolution number 6. I don't know if you're familiar with it or not, but this resolution was passed by WCA to urge the Wisconsin legislature to change the law to not allow parents the right to follow their personal beliefs and personal convictions when making decisions on how to raise their kids in certain circumstances because they believe the state knows best. WCA promotes this against families. Number 4, this spring they passed a resolution to take special effort to give a high five to an organization that is Marxist, anti-American, anti-family, anti-police, anti-law and order organization which holds violent protests and has done that over the summer, burns down private businesses in cities across the nation, engaged in a form of terrorism, you could say. And if you don't believe me, take a look at Wisconsin Right Now, a site that has it all listed. And Wisconsin County Association made a special effort to support them this spring. They are not to be trusted. Number 5, look at the salaries of their officers. And then you can see who they are really working for. And actually number 6, take a look at their guidance. And you will see that it is not friendly to the secured rights that we have here. So why is Dodge County taking $10,000, $15,000, $20,000 a year and sending it their way to support them in these endeavors? I don't know. Why would we want to follow their guidance into socialism? If you take a look at the whole thing from page 1 to 60, you'll see that that is really what it's urging. And it's against freedom. WCA guidance is based on Jacobson versus Massachusetts, a case law passed back in decided back in 1905. Decision was made then. It's likely to be overturned when challenged now because of the circumstances back then, which are different today. Marbury versus Madison all by itself could probably do it. You say it can't happen. Michigan governor, what happened there? She had all kinds of orders to shut her state down all summer long. And it was all based on her Emergency Powers Act of 1945. Went to the Supreme Court on Friday. The Supreme Court said that's unconstitutional. All your orders are null and void. And here she was standing on what she thought was law. That can happen here too. Jacobson versus Massachusetts is thin ice, and don't be surprised if Wisconsin Statute 252 could also be found unconstitutional as well through a notice of constitutional question. in federal court at the same time. We the people have venues for judicial review. We don't want to use them because they are after the fact, but we don't have to if the ordinance isn't put into place. Interestingly enough, there's a budget process going on now. Everybody's scrambling. We don't have enough money. How can we do this? If this ordinance is passed in any way, shape, or form similar to the WCA guidance, you will need a new section in that process because there's going to be litigation costs that you aren't figuring on. The general fund will be depleted more than it is being depleted now. Expenses to defend in federal court are going to get astronomical. In-house lawyers probably won't be able to handle what's coming from all the federal courts. You will have to hire some more. It's over the heads of many people. Dodge County pays all the expenses when they lose. That's what happens. So you really can't afford a health and welfare ordinance at the county level because of past spending practices. So we, the people, really will never, never, never break down or back down concerning our stand for our children's freedom. We aren't so much worried about our own. I'm 62. I don't have that much time to go yet. I could ride this thing out, but I have children behind me and I have grandchildren behind me, and I am responsible, as well as you, to make sure their freedoms still exist. The mention was made of the Highway Committee. Ironically, big 14-day. What happened to it? Cut short. The contact tracer that the previous speaker mentioned, named Natasha, a nurse from Madison, who basically said it's a royal joke in so many words. She didn't say those words, but the explanations came down to it is so out of control, you cannot trust these numbers. We had a local health official at the last board meeting make fun, in a sense, of the high cycles creating false positives and saying, well, if you cycle them too high, that's accurate. If you cycle too low, you're going to get false negatives. I forwarded all the supervisors my email to Abby at that time, requesting the documentation and the controlled studies that proved that low cycles produce false negatives, and have received nothing to this point in time. It only can make me believe that her opinion was proclaimed as fact to the Board of Supervisors, who were supposed to believe it. I have also evidence and documentation and studies at home that prove that high cycles produce false positives. And we have a retired doctor within Dodge County that's saying there is no such thing as false positives. Does that mean that his opinion is going to trump all the studies and facts I have at home? We have to consider these things. And numbers aren't trusted.
Amen.
We've covered that. The WCA guidance wants you to give the legislative body more power. They want the health officer to hide behind the legislative body who are elected so that we don't have constitutional problems. The legislative body couldn't even handle this last quarantine correctly, and give them more power, and we're supposed to see that the two levels of rules, one for the general public and one for legislators, isn't going to get worse as it is in state and federal government. That's what's going to happen when you do things to try to skirt constitutional issues. So I just encourage you to reconsider even pushing this forward any further. There really is no time and money for all this to happen, and we need to stop it before it gets any worse. Thank you.
My name is Michael Powell. My family has lived in this area for 199 years. I played in these towns, I drank in these towns, I did everything in these towns. I have two companies. And you're telling me now that I should shut down my two companies during the busiest time of the whole year? the next 60 days? Are you on your mind? I also had a friend many years ago, belonged to a group out of the 50s, Mr. Joe McCarthy got involved with that. And they taught me all about a thing called Marxism. In Marxism, I don't care how anybody votes, an executive order from the Constitution or constitutionalist, that rid of the whole thing with a stroke of a pen with an executive order right now, the way it's written. So vote any way you want to vote, it's going to be gone. Thank you. Go ahead, Susan.
I'm Suzanne Derry from the Show, and I just have a couple questions. First, when I was looking over the minutes and that from your meeting in your packet, it says on there that last month people were here complaining about the mask order. It has nothing about saying that we had issues concerning the ordinance that is being proposed. So I think maybe you take a look at that. The other thing I want to know is, we have all these questions, we never get answers. Is there a place that you guys are publishing them or getting back to people with questions that they have? I mean, I know they've changed things on how they're testing. So they've done different cycling as to increase the numbers. I mean, that's the whole thing. These numbers change all the time. They're fluent. We've had how many questions and nobody gets an answer. As an elected body, I would request that these answers are answered. Thank you.
Congratulations, Susan.
Hello, I'm Jim Tyler. First of all, I want you guys all to realize one thing. This is going to affect your family too, your grandchildren, your children, your house. It's going to affect you too. We don't need this. And just to touch on Dan earlier, when the higher ranking civil authority makes unjust or immoral laws, policy, or court opinion, the lower or lesser ranking civil authorities have the God-given right and oath-bound duty to interpose and refuse to obey the superior authority and, if necessary, openly resist the higher civil authority. Thank you.
We have 8 minutes left if there's anyone else that wants to make any comments.
Hi, I'm Linda Cockle, and I'm just going to kind of reiterate some things that were already said. Basically, I think there's a pattern here. I think all these people, I mean, everyone has spoken against this health ordinance. So I'm hoping that your people are listening, that this is what the people are saying.
Amen.
We are saying we don't want this. I've had a cold. Was I concerned about it? No. Maybe it was COVID. I didn't know what it was. And take care of it. You take care of yourself. You avoid the sugar, eat the garlic, and rest. And you take care of it, build up immunity, and it goes away. Why are we so afraid of this coronavirus? And it just seems like, how many articles do we see on the line that, it's nothing more than a cold. Yes, it's a virus. But it's not as deadly and severe as we were led to believe at the very onset of all of this. And it's getting to the point that, we're just not believing it anymore. We don't need to be taking these extreme measures. I know the last time I spoke, I got you a whole stack of information on the false case of masks, and everybody's still wearing masks.
Not everyone.
Well, I don't know if why they're not, but this is just something from Pastor Chuck Baldwin. He's the pastor from Liberty Fellowship in Montana. And he's a huge supporter of the Constitution, Second Amendment. He's an online preacher, very good.
his comment on masks is, he says, I'll say it straight out. Wearing masks is stupid, senseless, silly, downright servile. There's not a doctor in the country who doesn't know that masks are absolutely worthless when it comes to preventing the spread of the virus.
Amen.
And if your doctor is truly stupid enough to believe otherwise, you need to find another doctor. And you know, I get so tired of it. It's like, wear the mask, protect yourself. But it's like, let's look at the real science. Let's look at what these little viruses are. What are they capable of? How dangerous are they? Is the mask stopping them? I will tell you this. I was at the store the other day and I never wear a mask. And there was a pregnant lady there, visibly pregnant, with a mask on. And I'm just like, what are you doing to your baby? Blocking the oxygen, and not only that, but the buildup of carbon dioxide. What are you doing to the development of your baby? It just made me sick. Here's another headline, and it's like every day you just get stacks of this stuff. This one says, CDC now says 94% of COVID deaths had an underlying condition. How many times have we heard that? That, you know, you have these premorbidity problems going on with people. They had a whole list of things that are wrong with people. I used to work in healthcare. I used to see the whole page of problems that our patients had. And you know, I have to believe that a lot of the elderly people, they probably haven't changed since I've been in healthcare, that I could expect that same whole list of diagnoses, and but they died of coronavirus. You know, it's not true. Here's what's going on in Florida.
We're dying of a Chinese virus, not that what you guys call it.
The COVID-19 survival rates have many scientists, doctors questioning masks and lockdown. This is Governor Ron DeSantis in Florida. And he has lifted all restrictions on restaurants and other businesses in Florida, and he's banned all local fines against people who refuse to wear masks. And he did so after showing the new statistics just released by the CDC. And so here he is with his statistics. And there was a young man here who quoted some statistics. These are very similar to that. 0 to 19, the survival rate of COVID is 99.997%. From the age of 20 to 49, the survival rate of COVID is 99.98%. 50 to 69 years old, the survival rate is 99.5%, and 70 years plus is 94.6%. And this is on the Ron, Florida, right here. And this is what caused him to make these big changes in Florida. And it's like, this information is all over the place. Why is it that we're not listening to this? Please do not move forward with this health ordinance. Just like everyone has said, just let us take care of our own health.
Yes.
Amen.
Yeah.
Amen. Minutes left.
Banner from Village of Godspeed. I just would like to voice my opinion against any ordinances. I see this to be just a power grab that this county's trying to pull. And once it's this now, what's next? We're gonna have red flag laws next. We're having unelected officials be in charge of things like this. Can't happen. We have rights out here. And while I have a little bit up, not everyone here got to speak. Everyone that's here, are we all here to oppose this ordinance by showing?
Anyone else?
Steve Coffell, from Down Shields. I guess, with all this, the ordinance is coming, there's gonna be some additional ramifications. You have a gentleman sitting over here, our Dodge County Sheriff, who has taken a pledge to support the Constitution. Now, he is going to have to make a decision in his mind whether or not he is going to support this ordinance. Just because you pass the ordinance doesn't mean that he has to follow that, as far as I understand. He is the highest elected power in the county. And it is going to be up to him to figure out what he's going to do and how he's going to support this ordinance. Also, when it comes to getting information back from the board, Mr. Kotke should be held responsible, and Mr. Milkey should be held responsible for getting back the inquiries of the people. And I find it just abysmal that this county board is even going through with this. I find it real. You see the opposition to it, and it's not. You don't have the. You shouldn't have the will. You should have the people's will in mind, not your own.
My name is Jackie from Watertown. I've spoken before the board before. Thank you very much. I appreciate it. I could go through the statistics again about how inaccurate. Am I allowed to finish?
Go for it.
30 minutes is up.
You shut her off the last meeting.
Go for it. Go for it.
Let her talk.
Let her talk. The majority rules, right? I thought it was.
Just let her talk 2 minutes. What's
May I
the big
continue?
deal?
Go ahead.
That's my word.
Speak.
Obviously, a lot of people have a lot to say on this issue, and they are definitely opposed to this issue. You have heard me say before that masks are useless, and they are. They barely contain bacteria, much less nothing to do with viruses. I can tell you that the test results are wildly inaccurate. The ones by Abbott Labs, a company in the United States of America, they were told by the government not to use them anymore because they are so wildly inaccurate. The ones from China, forget it. You're not going to get any accuracy from them. We're basing, instead of what the government said in March, that we need to flatten the curve, and we did flatten the curve. It's not a problem. Everybody chipped in. We did it. But now they're changing. And now the changing is the number of cases. Well, in the medical world, when a doctor finds that there is an infectious source, that's considered a case. When you get a positive test with a very inaccurate test result, that does not mean that this is a medical case, particularly if there are no signs and symptoms of infection. That means that the tests are invalid. And we're testing people and getting invalid results. Based on that, the supposition is to close businesses, to quarantine people. Okay, got it. The governor declared an emergency in March, and after 60 days, it was canceled because he does not have authority beyond 60 days. Trying to do a mask mandate, it's a mandate, it's not a constitutional authority, he can't do that. And the Department of Health cannot mandate closures or anything else. We already found out that Andrea Pond can't do that. So now they're trying to force it down to the county level. The county level should be listening to the people, of which there are plenty represented here, that are saying, please, please do not even consider this wild idea of trying to enforce something that really is not a problem. There are not that many people dying from this. Yes, there are people getting sick. It's also influenza season. People will get sick. But the CDC admitted that the death rate in the United States of America, which today it's like 216,540 people, only 6% of them are actually related to COVID, which is a whopping 12,992. Has, in a regular year for influenza, hey, let's try 218, 219, there were 34,000 deaths. This one here only accounts for about 13,000. It is nowhere near a biggest problem that we see. And people have been working with the government to try to control this.
I'm gonna have to ask you to wrap it up, please.
Okay. I just respectfully ask that you not consider this at all, because the people do not want it. We do not need it. We do not need the government telling us what we can and can't do, how to isolate us, how to quarantine us, how to house arrest us, or whatever you want to call it. We need our freedom. This is a constitutional right. And this...
Read the Constitution, please.
This act here is is nowhere near abiding by our constitutional rights. Thank you.
Okay, I'm going to deviate from the agenda, and we are going to move down to number 7, the director's report.
Okay, so everyone can hear me, I don't know if anyone's upstairs, but it should be, going upstairs as well. So this is under director's report, but I will cover this, for those in the audience, quite a few of you. I'm Kim Nass, I'm the Corporation Counsel. Tonight on your agenda, the guidance is listed. The guidance was sent out with your agenda. It is also posted on the county website, as well as the draft ordinance, which was presented to the county board in June 16th, for discussion purposes. That draft ordinance is out on the county website as well. It has not been changed at this point. But for tonight's purposes, the guidance is on your agenda. I don't plan to read it to you or go through it with you. I trust that you've all gone through it. This is the product, as you know, of the WCA work group, Public Health Work Group, on which there were quite a few diverse interests that participated in that work group, including 2 corporation councils, a couple of city attorneys, as well as a number of public health officials, as well as individuals from the Restaurant Association and others. The product was made available at the end of July, and again, as I said, it is posted on the website, and it is just a guidance. It is not something that the county can or should or would adopt as an ordinance. It spells out many different areas, including the different types of orders that a local health officer could issue, all the way from a basic isolation order or a quarantine order, all the way to an order of general applicability throughout the county, much like Andrea Palm did when she issued the stay-at-home order back several months ago now. The other thing that the guidance does is provide just a general summary of the local health officers' authorities generally and communicable diseases. So any ordinance that would be drafted by me for the county board to consider would be tailored to Dodge County, and it would take into account.
How are you doing today, sir?
It would take into account the Dodge County's interests, and it will be reviewed by the executive committee and the Human Services and Health Board at their meetings in November. It is not on the agenda for tonight, and the guidance is on the agenda, but there is nothing in terms of action with regard to the guidance. The Human Services and Health Board may know, at least the supervisors on this board, may know that the county board chair set forth a path for the draft ordinance, and the path for the ordinance would be that it would be brought before the executive committee at its November meeting in draft form, and the draft that I will prepare will be much different from the June draft that is posted on the website, because obviously months have gone by, and as things evolve, we're being more informed by the various decisions of various state courts, as well as the Supreme Court and the federal court. So the draft ordinance will be brought forward to the November meeting of the Human Services and Health Board, as well as the executive committee for your consideration. And as always, I will be guided by the direction of those committees in terms of what to do next. I will look for feedback from the committees in terms of the draft. The draft will be available prior to your meeting, and will likely go up with the packet. And for the interest of the public here tonight, it will be posted on the website, so the public can get a view of the draft that will be presented in November. And from that point, where the ordinance goes will be up to the committees. It will be up to the committees and up to the zoning board. So again, I won't go through the guidance, but any members of the board, if you have any questions about what's in the guidance, I can try to answer them.
As I said, the guidance does go through the Wisconsin legislature versus Palm decision and what it says generally and what it doesn't say. Again, the guidance was not intended to be a draft ordinance by any means, and it specifically says that. And any ordinance that would be presented to the county board or first to the committees will definitely be tailored to Dodge County. This is not intended to be a cut and paste, and much of what is in this guidance is information that generally has already been known to attorneys that practice in this area. So I guess it is a good compilation of information, but that's pretty much what it is, guidance.
Is there anyone at home that has any questions for Kim?
I don't have a question for Kim, but I don't know if you can hear me now. This is Naomi Krewald. I've actually been here all night watching this. And I finally found the place to unmute my mic, so I think I'm unmuted now.
We can hear you.
Can you hear me now?
Yes, we can hear you. Can you hear?
Okay. I just wanted to check in because I couldn't check in before. I had just downloaded it and it wasn't all here yet. Thank you.
Thank you. And I will just offer that to the extent that any supervisors or board members, citizen members of the Human Services and Health Board, if you should have any questions with regard to the guidance or anything in relation to public health, you certainly can call my office. I can try to answer your questions if you don't want to ask them tonight or don't have a question for me tonight.
Is there anyone out there that has questions? If not, we will be moving on. Thank you. I'm going to back up to number 4, approval of the minutes of the September 2nd board meeting. Is there anyone that would like to?
Mary, this is Kira. I'll move to approve the minutes.
Okay, Kira, do I have a second?
This is Tim, I'll second it.
Okay, thank you. If there are no additions or corrections, I'll take the vote. All those in favor?
Aye.
Aye. Anyone opposed? If not, they stand as written. Then we have board action, the Children's Long-Term Support Waiver Program Budget Amendment.
This amendment, can everybody hear me?
Yes.
Okay. This amendment is before you tonight as we received additional funds to support the Children's Long-Term Support Program and any waitlist needs that we may have. We are currently in the process of providing additional case management services to children in need of these services.
Does anyone have any questions for Becky? Anyone have any questions? If not, would anyone like to make a motion to approve this resolution?
This is Tim, I'll make a motion to approve.
Thank you, Tim, you made a motion to approve. Who was that?
Kira will second.
And Kira seconds.
This is Naomi. I will second it.
Okay, thank you. If there are no other questions, I'll call the vote. All those in favor?
Aye.
Aye. Is there anyone opposed? If not, we will pass this resolution on to the next county board meeting. Next one, we will have Ms. Drays with the community service. Oh, nope, I'm sorry, we're gonna back up to number 6. Abby, are you there?
Yes.
Okay, would you like
Can you
to
hear
give us, yes, we can, give us an update, please.
Very good. So as of today, Dodge County has 2,268 confirmed positive individuals. 397 of those are from the Department of Corrections, with 1,871 being community positive cases. Of those community positive cases, 547 are active cases, which means that they're positive and in isolation. This 547 active cases are those confirmed cases, so that does not include contact of the positives that Dodge County Public Health is also following. We've been ranging probably between 2 to 4 contacts per person, with some people having no contact, but some people having up to 50 plus contacts. So contact tracing has definitely been very active. So of those numbers, our numbers really have exploded over the last month, and I just want to do a little comparison with that. At our last Human Services Health Board meeting, September 2nd, we were at 1,200 cases, so 1,200, and we are now again at 2,268. So we've almost doubled since our last meeting. And the last meeting we had 177 active cases, and we're now at 547. What's the number again? So really, we have definitely seen an explosion this last month, and especially this last week being one of our highest weeks. This last week we had 341 positives, with 82 in one day, that being our highest number of active confirmed positives in a day. So with the increased numbers, we are increasing our contact tracer staff to assist public health. We are also using human services and health staff from other areas, and also looking at using other Dodge County staff as well. In the last month, we've also seen an increase in deaths. We had been running at 5 deaths, and even at September 2nd meeting, we're still at 5 deaths. But now, since that last meeting, we're at 19 deaths. 9 of those are from long-term care facilities. 2 are from the Department of Corrections, and 8 are from individuals living in our community. Hospitalizations are also rising. We were at 67 hospitalizations at the last meeting, and we're now at 108. So that's an increase of 41 hospitalizations since the last meeting. We're also hearing from the hospitals that they are becoming overwhelmed due to the combination of the increased COVID-19 inpatients, that increased ER and urgent care visits, and also being short-staffed due to staff being ill and staff needing to be isolated or in quarantine as well. So we do also continue to work with the schools. That's been something we've been doing for months. My nurses talk to the schools almost on a daily basis to discuss quarantine, isolation, recommendations for safety measures to be put in place. We have not at this time seen any student-to-student spread. We have had students test positive and have quarantine classes because of that, but we haven't seen where it's been spread between student and student, which is a great thing. That means that the mitigation measures that the schools have put in place are working. Most of all the schools are still continuing in-person classes. Some are doing the mixed hybrid classes. We did today get notified that Wuhan, though, is going to be going to all virtual for 2 weeks. That is really due to staffing, not to, again, students spread. And I just wanted to clarify that because we're not yet reporting student spread, which is, again, a great thing. Means what we're doing is working. Testing is another area that we continue to focus on. We are not doing testing in, this is my staff doing testing, but we have been coordinating testing on a monthly basis with having test sites, the emergency management and the National Guard coordinating that. And the last one was in Phil, and we had 244 individuals that came through that test site. So it was a lot of people were calling us. They were looking for test sites. We do continue to have people on a regular basis call us, ask us where they can get tested. So we do understand that that is a need still in our community. So we are looking at increasing to weekly in the near future, possibly in this mid-ish October, and having the National Guard, again, in coordination with the National Guard, and hopefully be having them once or maybe even twice a week to meet the needs of our citizens. That's all I have. The needs still in our community. So we
Does anyone have any questions for Abby?
I have
Abby, how many went through the testing site in Reesville last week?
644.
Gosh.
Abby?
Yes.
This is Kira. Can you hear me?
Yes, I can.
How many tests would you say you're doing daily or weekly? I'm sure you can't do it daily, but do you have an average?
Is now joining.
As far as how the county's doing testing?
Yeah, how many tests are being done in Dodge County?
Okay.
Even if you have, are you doing an average of daily or weekly? Do you keep track of that?
Yeah, we do keep track. And again, I want to invite everybody to look on the Dodge County website, because we do put out a weekly report, and that does break down how many tests, how many individuals have been tested in the last week, and I just want to make sure I have the correct number for you. This last week we had 1,164 negative tests, but I do want to point out that the negative tests are new individuals tested, so that's the way the state tracks the test is by individuals tested, not necessarily by somebody who's been tested multiple times.
Thank you, Abby.
Are there any other questions for Abby?
Yes, I have a question.
I'm sorry for the committee.
I've been in jail before for minor things.
I'm sorry, but this is for the committee members only. Public comment is over.
Thank you. Kyle.
Are there anyone else on the committee that has a question for Abby?
No. Abby, this is Lois. I'm sorry my computer went in and out of, so I'm not exactly sure what Bob said in the last couple minutes. But is it accurate to say this, and maybe you said that there were 435 new positive last week? Is that about right? So over 400 anyway.
Well, last week, our weekly count, which when I say a week, I'm going off of our weekly report. And so last week, we had a total of 341 new cases in 1 week, and that's from a Monday to Sunday. So that was ending Sunday.
Okay. All right, and that's up from what we've been having, is that correct?
Definitely, that's our highest week that we've had since since COVID, since we've been following this. The week prior was another high week, but with 237. So we had over 100 more than our top week comparing the last 2 weeks. So it's definitely been up.
And I was looking at the breakdown, I mean, it looks like the highest category was 40 to 49, but if you look at like the ages of 20 to 60, 59. I mean, that's where the cases are, so it's not, so it's where people working, it seems like, that are the highest positives right now.
Yeah, we're definitely seeing it in workplace outbreaks. We're not seeing it that our highest, one of our highest age groups is the 50 to 59-year-olds. So we're definitely seeing it in the older adults, not necessarily all in youth. As some other counties are reporting, the college age youth they're having large outbreaks, which we are seeing numbers in that age group for sure, but definitely our older 50 to 59 is one of our top highest age groups. And that is in the weekly report.
Yep, that's what I'm looking at. Thanks.
Is there anyone else on the committee for Abby? If not, thank you, Abby. And now we will move on to number 8, community support services. Sheila?
Yes, hi.
Hi.
This is Sheila. So in your packets, you should have received the statistics for my division. And most of it is just ebb and flow, but one thing I do want to point out is under economic support, you'll see that there was a large increase in food share expenditures, and that was due to food share recipients receiving the full allotment, as they have done one other time, and so that shot our food share allotment up for that month. I don't know if anybody has any other questions about the statistics?
Anyone have any questions for Sheila?
No.
Thank you, Sheila. Anything on the dining center comments?
They're kind of short.
They were very short this time, yes.
Yeah, we didn't have very many this month.
That might be a good thing. Economic support fraud case?
Yeah, so we thought we would bring this to the board's attention. We have a position within economic support. It's a fraud overpayment specialist position that we've had for a few years now. And we discovered that there was a client who was fraudulently receiving food share and childcare between the years of 2014 and 2018. She was found to have fraudulently signed a wage record indicating that her wages were lower than what they were. And then also the father of the children had been living in the home, and she had reported that he was not. And again, there was some fraudulent verification that was sent in for that. So the economic support worker worked with the sheriff's office to uncover some more verification that we used, and the case went to court, and she was sentenced to 5 years probation for public assistance fraud, and also she has to repay food share overpayments in the amount of $13,277, and child care overpayments were $36,763.
Wow.
Have there been other fraudulent cases?
Oh, sure, and we have a person working on it all the time. We are just now, within the last couple of years, working more closely with the court system and with the sheriff's office to actually get them through that process, but they have to be, worth a little more to make that worth our while. But yes, there are a lot of other fraud cases out there that the fraud worker just handles. They're a little smaller amounts.
Too bad. Thank you.
Good job, Shay. Are you also taking the 2020-2021 aging unit plan review?
Actually, Chris Sheft is on, and she's going to talk about that a little bit.
All right.
Thanks, Sheila.
Yeah.
And I'm assuming people can hear me and see me?
Yes, we can.
Excellent, okay.
This is a semi-routine review that we have. For those who don't know, seniors are funded through a 3-year aging plan through the Older Americans Act. And this board, the Human Services Board, is actually the policy-making entity for aging services. So we write the goals and we bring them back to you to show where we're at, where we need help. This year, well, because of COVID-19, we've had to modify how we do things. Well, we still have the 6 categories that I just wanted to touch briefly on. So the first is aging advocacy. And things that we have done in this past year is we've participated and promoted census data gathering. We have promoted voter registration, and we are now offering our Medicare 101 class virtually, so via Zoom. So as seniors are aging and needing that help, we're still able to provide some education to them, just in a different way. And we also work very hard to keep our Facebook and our newsletter up to date and relevant with updates with COVID, as well as other resources that are available in the community. The second category is elder nutrition program. So during April through August, we have delivered frozen meals to participants, where we do it 1 time a week versus every day. This was due in part to volunteers stepping down temporarily due to COVID, congregate dining site closing, as well as mitigating the risk of exposure to our seniors. Daily welfare check calls were conducted when we were not delivering every day, so we were still having that one-to-one touch as much as possible. We also provided fun activities, educational information, and global postcard messages sent to the participants every week. So we know that isolation is huge, and we're doing the best that we can to reach out to the seniors without actually being able to touch them. We have developed partnerships with local food pantries to ensure free contactless food boxes have been delivered to Dodge County residents. And 225 households received senior farmers market vouchers. Contact delivery method was used during the summer. We also provided shelf-stable food for residents as needed. So these are different goals than we had before, but we're still supporting the community. Our third added category is providing services in supports of caregivers. We used to do a lot of hands-on, face-to-face support groups. We're now doing that virtually. Part of that also includes trying to get equipment out to seniors, as well as hotspots, so for folks who might be in remote areas, so they can access some of these programs. So one of the programs we're calling it Scout. So that's supporting caregivers online using technology. So we're just getting started with this. We have a staff person who is teaching classes at the Watermark in Beaver Dam on how to Zoom. So we can't expect people, I mean, this is a new thing for me, just doing Teams tonight. I can't imagine how frightening it might be for some others as they're just trying to learn how to get a handle on some of this technology. Our fourth area that we cover is supporting services for people with dementia. Typically this time of the year, we would be doing a big dementia walk and education. We can't do that this year. So we are doing a storybook walk in 4 different communities: Watertown, Waupun, Beaver Dam, and Eustisburg, 4 different sites. And we're featuring a book called Grandpa and Lucy, which was written by a young adult. It's 18 pages long. So we start at one end of the library and it goes around and outside, or different ways to access it. So we're doing the best we can to do outreach. It's outside, you can do it at your own pace. And in addition, we have certain times you can also get a copy of the book for free. So that has been funded through some of our grants. And then we're also continuing to provide virtual support groups and dropping off dementia education and activities bags at those homes of people who we previously supported. Our fifth goal is on healthy aging. So the Wisconsin Institute for Health and Aging has reformatted most of their classes to be held by Zoom, and we have 3 staff who've been trained to offer these classes. And our last area that we're continuing to work on is local priorities. And what we've identified previously was that we need to continue to recruit volunteers to keep them interested and feeling active and meaningful, as well as providing them the training that they need. And we now have 1 staff person who recruits volunteers and trains them, and she's engaged over 50 volunteers since she started this initiative in 2019. So we're working hard, we're working different, but I will be coming back to this board in 6 months, if not before, just to tell you what we're up to and where we're going to be going next. That's all I have. If anybody has any questions from the board.
Are there any questions for Kim? None here. No?
Thanks, guys.
All right.
Thanks, guys.
Thank you.
Appreciate it. Bye-bye.
Bye. Next, we're doing clinical and family services. Alyssa?
Hi, yeah, can you hear me?
Yes, we can.
Okay, good evening, everyone. So in front of you in your packets, you have board information from my division. The same information I typically provide, and I don't see any standout trends, but I'm happy to entertain any questions you might have about any of the data. I would note and would like to note that as of yesterday, we have both of our out-of-state youth who were placed, one in Georgia, one in Tennessee, back home in the state of Wisconsin. So that is really good news. But any questions that anyone might have, I'm more than happy to try.
Are they discharged to home, or are they in a county facility, or where?
Good question. So neither of them have discharged straight back home. Both are in step-down facilities, RCC, high-level group home facilities at this point. And we will continue to work on
in our county also.
I'm sorry, no, they're not in our county.
Oh.
But they are in the state. We don't have the types of facilities here in the county to meet the needs that they have as they step down at this
Right,
point.
they're getting closer.
We're happy to have them closer, absolutely.
Alyssa, on your facility sheet where it lists the different facilities, it has Bellin, Bellin. Is that new?
No, that is not a new facility. That's a hospital facility that we don't get as much contact with because they're fairly specialized. And if you were to ask me right now who we typically send there, I might not be able to answer that question for you, but I could definitely find out the answer. They're not a new facility to us, basically placed based on the individual's insurance. So that decision would be based on that.
Okay, that's all. Thank you.
Okay.
Are there any other questions for Alyssa? If not, thank you, Alyssa, and we will move on.
Thank you.
Fiscal and support services.
Good evening. We're going to start with 2020 expenditures and reviews. The first report you all received in your packets was wrong. It had a tax levy that was through the end of the year. And after it was brought to my attention, I changed it and I sent you guys out one on Monday. I had Chris send you an email. The updated one that shows the actuals from August 31st. So looking at that, we were doing well and we have a surplus. And then for your information, our bioterrorism planning grant that we receive every year, it runs from July to June. We did get a slight increase in that grant. It was only about $375. Do you guys have any questions about that report?
Anybody have any questions?
Services and Health budget. The 2021 preliminary budget was presented to the county board. This is the overview that you guys received in your packet. The county's change from 2020 levy is about 0.04%, so that is $3,708. We have anticipated additional COVID-related expenses. There is a $300,000 in the 2021 budget to help cover 6 months of expenses. It is unknown at this time if there will be any state or federal funding to offset the COVID expenses. So with the uncertainty of the funding from federal or state, we have earmarked $300,000 in our Human Services and Health Department fund balance to be used if federal and state funding is not available. Does anybody have any questions on the 2021 budget overview?
Where did that $300,000 number come from?
That was all done before I started here, so I can't really speak on how they came up with 300,000. Maybe Becky could.
I can address part of that, Dave. For that $300,000 is just an estimate based on some of our expenses incurred to date, and trying to extrapolate that through the first half of 2021. As an example, the contact tracing expense. So we're taking a look at that expense so far in 2020 and trying to anticipate going forward. And as Angela had indicated, the big unknown at this point is whether there will be any continuation of any state or federal funding. But we certainly believe through the development of the budget that it's prudent to allocate dollars towards COVID, because we certainly don't see a switch being flipped as of January 1, that those expenditures will go away. So we're trying to be prudent in how we approach the 21 budget.
Thanks, Jim.
And also, if I could add just a bit on the budget process, as Angela stated, Angela started on August 17, and has done a fantastic job of learning the budget process, worked very closely with Alyssa, Sheila, Ann Connors, Dave Ellinger and I, the finance director, met with them on multiple occasions to walk through the ideas and thoughts on the 21 budget. And I know there's been constant communication since that time, working with the finance department, and it's really been a very good process. It's still a work in progress, but overall, we believe internally that what's being proposed or will be proposed and under consideration on November 10th meets the needs of the residents and the clientele going forward into 2021. And so I certainly want to express my appreciation to Angela, Ann, and Alyssa and Sheila for their cooperation and willingness to dig in and spend quite a bit of time putting everything together. And also thank Becky for her support on the budget and going forward in 2021. So we have to wait and see what county board, if there's any county board action on November 10th, but we're very pleased and I'm very proud of the way that everyone stepped up in the last 60 days on the budget process, and we want to thank them for their efforts and time on this.
Thank you.
Is there anyone on the committee that has any other questions on anything? Okay. All right, next meeting is Wednesday, November 4th at 6 p.m. Does anyone have a problem with that? If not, before we wrap this meeting up, I would just like to say thank you to everyone that is in attendance from the public here. You all were very orderly and very cooperative. I know everyone has something to say. We have to go by what the rules are, and don't make them, I just have to abide by it, but thank you for being a very orderly group tonight. So with that, I will call this meeting adjourned by order of the chair. See everyone next month. Thank you.
Excuse me, Mary, I'd like to just make a little statement again.
Okay. All right.
I had a medical appointment this afternoon and got home at a little after 4 and had no idea what I was doing here with this thing. And then I had some phone calls, but then at like 5 minutes before 4:30 closing time, I called the S&H office there. And I don't know who the girl was that answered the phone, but my kudos to her. I really appreciated her because she explained the step-by-step process and what I could expect with each step. And, well, I did not really